mandate by the legislature. We are encouraging people not to self-censor. A lot of times, and I'm guilty of this too, I'll read an article or I'll read a quick description of what this money is supposed to be used for, and I'll think about a project and say to myself, well, I don't think that's eligible, right? That doesn't seem like a project that this money can be spent for. Like I mentioned before, there are many pools of money, but more importantly, the amount of information out there on guidance for these different programs is deeply overwhelming, right? Tens of thousands of pages of guidance between all these different programs. It's impossible for any one person to know. So we're not asking people to spend any time on whether or not something is eligible or ineligible. Obviously, you'll have to go through that work at the county level for dollars the county spends. But we're asking people not to self-censor. Just tell us what you need and how you would fix it. And, lastly, share the message with as many people as you can. And of course, we are here to help. Again, I'm Zach Conine, your elected state treasurer. Thanks so much for having me here today. Happy to take literally any questions.
Your 75 events in 75 days, are we going to be notified well in advance of whether the governor or your committee is going to be here? Starts in August and ends in October?
Say again, sir.
It starts in August and ends in October.
Yeah, around October 15th is the end. There isn't it's not a hard bureaucratic process, right? It's more of a kind of to focus the efforts within a 75-day window. Of course, if ideas, after that, we'll take them, right? It's not like there's some sort of hard line. Absolutely, we can send you a list of events that are going to be in White Pine or Ely or the surrounding area, and I'll have my team do that right after the call.
Yeah, and have them coordinate with Elizabeth if you would.
Sure.
Okay. Anyone else got a question of what the state's given to us? We appreciate it. Look forward to working with you. Anybody else got anything to add? I hear nothing, see nothing, but we appreciate you, and that was a very, very well presented item, and we'll be looking forward to working with you.
Roger that. Thanks so much for taking the time. And again, if anybody needs anything, don't hesitate to reach out. We'll coordinate through Elizabeth. Thanks so much. Have a great day.
Thank you.
Thank you.
Okay, we are rolling right along. We're at page 2. Item B, it's a 9:30 timed item. It's the Eureka County Sheriff Jesse Watts. Item 1 is discussion for possible action, the approval of Resolution 2021-74 in support of Eureka County Sheriff Jesse Watts in response to a petition to recall filed against him in Eureka County. Travis.
Thank you, Mr. Chairman. Sheriff Jesse was going to be here, but texted me this morning and had some stuff come up and wasn't able to make it. Essentially, I just saw this and looked into it. I've known Jesse for 8 years myself, back when he was a deputy and everything, but I'll let James and Scott chime in as well, but Jesse's been a tremendous partner to us, and what he's going through is very not nice and politically motivated, and I think we just need to stand up for our rural sheriffs when they come under these attacks, and let them know that we support them, and like folks that stand up for our freedoms and willing to do what it takes. And I'll let James speak more on what Jesse's done to help him out as far as being a neighboring sheriff, and go from there.
Thanks, Travis. I agree with what Travis said. Jesse's been a real good asset. When we had the Capitol murder happen, we were very grateful that Elko was able to respond with their armored vehicle. But that is 3.5 hours away. Jesse was able to obtain an MRAP, which is another armored vehicle that is between an hour and a half away now, and without asking for any money, any compensation, or anything, offered those services to White Pine County and other neighboring counties. Jesse has helped out in portions of the investigation in that DeBris case. He has provided kind of behind-the-scenes support in that case as well. Whenever I have a question or I have a concern or a need, he's always available for me to call. Last time I talked to him, it was on a Sunday. I had left him a message, and he called me back on Sunday. Just willing to take some time. I know this is this can be seen as Eureka County only issue, but I personally, really appreciate the guy. I think he does a great job. And, I can't say enough about him. I think that the timing of this is really curious, given that, the election season is gonna be coming up in like 6-7 months from now. So I wonder what the motivations are behind this, given the timing. But those are my 2 cents. And, I reached out to some law enforcement. I don't want to name them specifically, but generally Jesse is supported by law enforcement, I can say that. So I think I'll leave it at that.
Thank you, appreciate the opportunity to speak on this subject. First, Commissioners, thank you for even considering this. Travis, appreciate that. Right when Jesse was elected, he and I had the opportunity to sit down and discuss some of the things that we'd like to see our counties join together and become. I can tell you right now, the only thing that he has shown to White Pine County is support professionalism. District Attorney Beecher hit on some of the high points there with the incident with Trooper Jenkins when he was killed in our county. He was one of the first sheriffs that I heard from to reach out and provide that assistance. Other sheriffs came to our support in that retrospect too, and we appreciated all their support to apprehend Mr. Daybritz and to bring him to justice. Sheriff Watts, you know, is very supportive of our task force. He helps to contribute to that funding source that helps us to provide that Tri-County Task Force, which is extremely important when it comes to our narcotics and illegal drug activity in all 3 of our counties. He's so supportive of that. Unfortunately, in the last month, we both had an officer-involved shooting. We sent officers over there to assist him in his investigation, and also to, our officers were there during the whole incident from until we basically found that individual was deceased. When we had ours, my phone was ringing off the hook. He was actually sending himself and another deputy over to assist in handling calls because of the amount of manpower it took to work our scene and all the things that we had to do there. As you're aware, I'll be talking to you in a little bit about an MOU agreement that he is requesting to have us assist him with some of his jail issues that he's occurring over there. Accident response, ambulance responses on the west side of our county, they're there. They just send them, there's no questions asked. So as you consider this resolution, I just want to reiterate his professionalism and his support for White Pine County. I've never had any issues that I would even bring to concern with the commission at this time. I don't know the actual reasons why this recall is being pushed forward, but I throw my support towards Jesse on his actions and dedication to assist us. So thank you.
Thank you, Scott.
Thanks.
A quick question,
Yes.
Travis. Has anybody reached out to the commissioners?
I did have a conversation with Commissioner Richard Gage.
Okay, 'cause the only reason, because I mean, I don't know the gentleman personally. I do know that they have always been a good resource, and it has always been a really good, I emphasize that, working relationship with them. I find myself just a little bit hesitant because I don't know what the particulars are, and not knowing, it's the voters' rights to do whatever they, and we know that for various personal reasons, a lot of times somebody will get something going, just because they're personally angry. So.
Yeah, and I mean, look at,
I mean, I know, for as long as I've been a commissioner, we have had a wonderful working relationship with Eureka. So,
Sheriff Watts is a person that you never have to wonder what he's thinking. He's got some very strong opinions, and he's not afraid to let you know. Unfortunately, that paints a target on you sometimes, and it's got these people coming after him for what I believe are completely unfounded reasons. I have no problem supporting this. I believe we need to stand behind him. He's been nothing but a great partner to White Pine County, and this just seems like just an abuse of the system.
And like I said, I've known him for 8 years now, and if there was any question in my mind that he had done something that was of this level to get recalled, I wouldn't have brought it forward. But, you know, I've known him, he's a good man, and, you know, if Eureka County chooses to elect a different sheriff in the upcoming election, and that's their business. But, you know, it just exactly to Shane's point, you know, he's just getting a target somewhat painted on him, and, you know, we're politics is politics, but we need to stand behind it, in my opinion.
And if I could just clarify, this doesn't affect the process the voters
Oh, I know
initiate.
that.
So this is just showing our support if it's so voted.
Ian, you have a comment?
If we don't back good people in law enforcement and other places, there will be less of them.
That's it. Okay, I have a little bit of a different take on it. We're White Pine County, there Eureka County, there's Elko County. And when you, as a board or as a county, cross the lines and enter into another county's political sphere, you're putting White Pine County, we've had people try to be recalled, and we've had recalls. I can't stand recalls. I don't think anyone should be recalled. I believe that you've been elected. You know, the next election's coming up in a short period of time. Vote the way you'd like. However, as a county, are we doing the right thing crossing into another county's business? And boy, as individuals, we can do whatever we like and send letters of support. I would support that 1,000%. But as a county, and going over and crossing boundaries, crossing into Eureka County in this instance, I don't think is the right thing to do as a board or as a county. It's Eureka County's business. Eureka County, I don't know anything about this. I know I've met Mr. Watts. I've got no problem with him. I have never heard anything from anybody in Eureka. Whatever their instance is, I don't even know why they're doing this, but recalls are, to me, a waste of taxpayers' money. They're a waste of time. There's an election coming up. Take your opportunity and do that, but as a county, and not as individuals, I think us passing this resolution saying White Pine County is crossing into your community and saying we support without really knowing what the issues are. And I don't know that any of us know what all of them are, but I think it sets a bad precedent, and I don't think we should do that as a county. However, I think that I don't agree with recalls. If each commissioner or anybody in this county would like to send a letter of support, put an ad in the Eureka County newspaper, whatever you'd like to do, go to some of their town halls, that's fine, but not as a commission. I don't think that's the right thing to do. I don't think we would set a precedent if they have a recall in Eureka or Elko or any place, or even White Pine and somebody else coming in here, and with a larger population, you override another population. I'm just voicing my opinion. I heard all the commissioners. I agree with you. I have no problem with Sheriff Watts at all. I barely know the man, but I've never had a problem with him. But I think as a county, passing a resolution of entering into another county's political sphere is the wrong message. And so, that being said, unless another commissioner or anybody has something to add on this agenda item, we think it over. If someone wants to make a motion to do it, that's fine. If you'd like to speak one more time, that's fine.
I'll make the motion to approve, and we'll see where the vote goes.
Okay, that's fine.
I'll second it.
There's a motion by Travis and a second by Shane. Any further discussion? All those in favor?
Aye.
Opposed? Nay.
Aye.
I vote no. So it passes 3-2 with Commissioners Boas.
No,
4-1.
yeah,
Oh, I thought you voted no.
no.
You voted yes?
I voted an aye.
It passes 4-1 with Commissioner Bybee, Carson, Godon, and Bovis in the affirmative, Commissioner Howell votes no.
But you do have a very valid point.
So, thank you very much, but that's just,
That's kind of what my thoughts were too, but
that's why we have a board, and that's why you hashed it out, and this was good dialogue, and we've all voiced our opinion, and the vote is the vote, that's the way it is, that's the way government works, so it passes 4-1, let's move on to the next item.
Thank you, everybody.
Yes. Okay, we are at the 9:45 special, perfect. Page 2, 9:45 Special Board of Public Health. I'll recess the regular county commission meeting and turn it over to Darren, who just is here. So,
Thank you. We'll go ahead and convene the meeting today. Start with public discussion, if any.
Thank you, Dr. Kuntz. I have a concern. I attended the Tour and Rec Board meeting yesterday, listened to a presentation, and one of the concerns came up during the conversation was a possible resurgence of COVID during the time of this event next year. And when that was said, Mr. Bullis said, don't worry about health issues, the county commission is in charge of all health issues. If that's the case, as a taxpayer, I don't want to pay for Mr. Kuhn's salary. If we're not going to listen to him, he's got signs behind him, you guys don't. You're sending out the wrong message. Either we support the public health officer or we don't. And then for any county commissioner to go out there in a public meeting and say the county commission has the last say on health issues, you guys are all wet. Save the taxpayer money. Pull the $50,000 or whatever. Remember you were paying $100 to one gentleman in the past, and you booted him out, and now we're playing the same damn game. That needs to stop. You have to make a commitment, whether you like what's going on or not. Thank you. I'd like the stats too, if you have them, please. Thank you.
Thank you, George, or Mr. Chakas. Any other public comments? Is there any public comments on the phone?
let me pass this up.
Yeah, thanks. Seeing no public comments, we'll move on. So before you is the most recent update. We'll open number 1, where I give you an update on what's going on in our county. Currently, there's 8 deaths total for this whole pandemic. Active cases in our county are up to 54. Hospitalized, we're down to 1, which is good. We've had a total of 746 individuals sick or diagnosed with COVID. We've had 683 recovered. White Plain County stands at 40% vaccination. The state's at 50%. The nation as a whole is 52%. Things to keep in mind, we've had 0 patients that have been hospitalized that have actually received the COVID vaccine. August to date, we've had 74 active cases in August. 8 out of the 74 were vaccinated, so we are seeing those that are vaccinated also having COVID cases. The majority of them being the Delta variant. Pfizer on Monday morning was approved for FDA approval for the official approval, I guess, if you will, with the FDA. It's no longer emergency use. What that means is maybe some of those holdouts that are waiting for FDA approval will go ahead and decide to get the vaccine. Moderna will probably follow suit either later this week or first thing next week, I assume. And of course, they've all but Johnson & Johnson have been approved for a 3rd shot come September 20th for the public. So if you need a booster, that'll be available to you. Every week I attend a virtual conference with CEOs of hospitals and emergency room physicians and hospitalists from all of Utah, Wyoming, and Nevada. It's all ran by the University of Utah specialist by the name of Dr. Edward Kimball. I put a quote in there from our last meeting. He tried to go through a few things people always say. Hey, people don't die from this. No, it's not true. It's becoming less and less true. The young aren't affected. No, we're seeing more and more cases. In our own county, the youngest person currently to have COVID-19 is less than 1 year old. Thought that would be an interesting thing to visit with you about. As you can see, if we flip through, the hospital recently took out an ad in the paper. This is the ad. This was a great ad. All the medical staff had a meeting, had a discussion, and voted if they should put some kind of letter in the paper to support what's going on in our community. This was their letter. I fully 100% agree with everything in this letter. It's right on the money. It was spot on. All the doctors are in favor. You go to the second thing, monthly cases. Wanted to present this a little different to you. Monthly cases, as you can see, the orange line is 2021, the blue line is 2020. These are the number of active cases that have occurred. What should scare you about this, and yes, I said scare, I'm not trying to do scare tactics, I guess I will. What should scare you about this is if you look at 2021, the numbers are skyrocketing past what they were last year. Okay, well, we've been doing this a long time. Why is this scary, Aaron? Well, the scary part is 50% of the county is vaccinated, or 40%, excuse me. And we're still seeing this jump in numbers. That's to tell you, and us as the Board of Health, the Delta variant is not to be played around with. We are seeing problems already. Let's talk about problems. Here's the problem. It's not if you're for a mask, it's not if you're against a mask. It's not if you're for a vaccine, it's not against if you're against the vaccine. The problem is this. Last week, I witnessed friend / neighbor / citizen of White Pine County sit in our ICU for 4 days. We had nowhere to send this patient. They were not for COVID-related concerns, had major medical going on. Nobody in Idaho would take her. Nobody in Utah would take her. Nobody in Nevada would take her. We finally reached out to California. We almost got her into California. So now we're reaching to California. It fell through. Dr. BN finally found her a place. Changes on a daily basis in the Salt Lake Valley somewhere. Can't remember which exact hospital. It's not COVID related. That's the problem. These are our neighbors. These are our citizens that we're sworn to protect. We can't even get them on a plane when they need higher level of care. Yesterday, point in case, talked with Dr. Robert Owen, the emergency room physician. Had a patient come in. Won't share a lot of details, probably give too much away if I did. Same thing, patient needed a higher level of care. He contacted all the hospitals in Utah, nobody would take the patient. All the hospitals in Nevada, nobody would take the patient. He called Twin Falls, Boise, Pocatello. I think he even tried some in Arizona. I should have wrote them all down. Nobody would take the patient. Why? The whole works are gummed up with COVID. You believe in COVID, you don't believe in COVID. I don't care at this point. But it's enough of it's out there. We can't even transfer a patient out of our community who needed desperate surgery and now is left to perish. Literally. He will die now because he cannot get out of our community. That's sad. That's sad to me. And it's tragic. And it's got to end. So, for what it's worth, I wanted you to see the Delta is on the rise. We have school coming, okay? We have vaccines on board. We have those that are going to wear masks at school, those who are not. The school boards come out and said, hey, we're not going to do this because it's too hot, it's too political. I met with Adam Young, it's too hot, it's too political. We're just gonna recommend you wear a mask. We're gonna talk about some resolutions today and some things. Something you might need to consider as a Board of Health is to say, should we put something out that says what we wanna try to do to curb the spread? Because this is alarming. If that was your grandpa that was gonna die yesterday, or the woman that sat in our hospital for 4 days waiting to find an expert that can handle her care better than our primary MDs and Ely, you would have a different opinion right now. Okay? Like I said, for or against COVID, it's here. We're stuck. I don't know what to do. I'm frustrated. I've talked with the hospital board. I'm frustrated there. I've talked with the physicians. I'm frustrated there. Our community members, every time I post something, you get those wonderful loudmouths who think they know more because they have a high school diploma and they've read Facebook and they're Facebook warriors. I say, bull crap, it's time to end. We've got to do something as a board, okay? You don't want to, I had a smile. President Trump, God bless him, got booed off, not booed, but booed when he suggested the nation get vaccinated the other day in Alabama, Arkansas, somewhere where he was out beating the bushes. How sad is that? Former President of the United States, who through his leadership got us this vaccine, and he got it through us quickly, okay? Very quickly. Warp speed, they called it. And now we've got a Democratic president who also is trying to push it, and we're getting lots of resistance. So let's bring it home. Let's see what we can do as a commission, okay? So I don't know what the answer is. That's why we have this commission. We are no longer flagged, last page. We are no longer flagged as a county according to the state standards, okay? So with that, that'll change probably the next time this is updated. This is a 14-day rolling average. Since then, I've had, I don't know, 8 or 10, 12 cases a day positive, right? And if you remember about cases, just so you guys remember, it's a 10-day quarantine at 10 days. If their symptoms have improved, they have no fever, off they go. They don't have to be retested. They can go back to their life, go back to work, go to school, play, do whatever they want. So these numbers are changing constantly. Every day I update the list. Take some off, put some on. Take some off, put some on. Again, I visit with every citizen in our county and talk to them. They're all respectful. There's a lot of misinformation in our county, and I don't know how to correct it. One gentleman, funny / ha-ha story was, I'm sicker than I've ever been. I don't know how to get over this. I'm throwing up, I have fever, I have headache, I have body aches, diarrhea. I don't know how to survive this. Did you happen to get the vaccine? No, and I'm not going to. Wait a minute. You're not going to take the vaccine? Surprise. That's fine. My conversation, that's your choice. I appreciate that. But you're sicker than you've ever been. Yeah, I don't want anybody else to go through this. So I'll stay in quarantine. It's not clicking, guys. We're not getting through to our public, the constituents we're sworn to protect. So just wanted to put it out there. We are a council. The DA will keep us in line, which I appreciate. But questions, comments, concerns, what do you got? What have you heard? Your constituents are talking to you, I'm sure.
Darren, what I hear.
Sheriff.
Yeah, thank you. What I hear is exactly what you're talking about. There are the pros and the cons on the vaccine. And even within my office, that's a hot topic. There's still the fear of the long-term consequences of the vaccine that I don't know how that will be squelched until history tells itself. So I don't know how that can be presented to squelch those fears. Because just like you say, even in our community, there's that division. So I think that those fears need to be addressed by professionals, maybe more media outreach, with all sources, paper, Facebook, radio, whatever it might be. But I think that that's your biggest hiccup, is those individuals that are hesitant about getting that vaccine because they don't know what it's gonna be